was just the prosthetic inside, but being gentle at the same time. So let's go straight to the point. You need the gloves. So just now wear the gloves a tiny bit. Of course, we are in the exam, we are real gloves, so I will have to wear gloves. Good. Then you need a gel. Okay. Good. So I'm just going to remind you. Good. Then we need the gel. This is the gel. Yeah. Just going to do that. Gel. Just going to open the gel. Good. And I'm going to put on my finger. Yeah. As you can see. Yeah. And I'm going to do that. My finger. Good. Done. Now, the common mistake is insertion. So what you want to do when inserting the finger in here is you place the top of your finger on the anal sphincter, like that. So I'm coming from the side, and ideally should be kneeling down. Okay? Ideally should be kneeling down. So I'm going to kneel down. I'm coming from the side. Now remember, the patient is lying on the left. So this is the left of the patient, this is the right of the patient. So I'll place the top of my finger like that, and then I'll slide the finger slightly backwards. Then I'll bend my finger. So I'll actually introduce with the finger bent, like that. Okay? Now, once you, the common mistake, so I'm going to show you the common mistake is people just to put the finger straight and say, I'm introducing just all the way straight like this. Okay, it can't be. So you have to do like that, and then a sphincter, slightly slide, and then bend, and then you do like that. Okay, with the finger bent. Once it's inside, I'll say start from the top. Now during an examination, do not verbalize. Yeah. So here you're going to swipe your finger. There's nothing. When you want to turn, have to be slowly. And again here, and again slowly swipe, and again put it down, and again slowly swipe. You can see my finger rotating all the way. And when it is anteriorly, you take your time, and that's when anteriorly you're going to feel for the prostate. Again, very gentle, not too rough. Okay. You're going to feel for the prostate, the two lobes, the median circus, okay, and assess for prostate consistency. When you finish, just warn the patient you're moving the finger, and then remove. Look for bleeding or discharge. So basically, what's a common mistake is introducing straight. You should rather introduce it slightly bent like that. So again, you press there, slide it backwards, bend against the posterior wall with the finger bent, and introduce. Okay, good. So the finger will be bent when actually introducing the finger. Yeah, so that's the common mistake in there. Yeah, like that, slide, bend, and then you introduce the finger bent like that. Okay, good. So that's the insertion up there for us, and that's the common mistake. Then you go inside, feel on the right lobe. This is the right wall of the rectal. Then when you turn slightly, the posterior, then you can do that. That's going to be the lefty. And then you continue like that. That's going to be the anterior. And then you're going to feel. You can see I'm kneeling down. That will be the best position for you to do. Just be slowly moving and you're feeling, concentrating only to get the findings. You end up being rough and still being failed in the examination. Thank you.
Hello.
Hello.
Can I have your GMC number, please?
Yes, please.
Okay, have you understood your task?
Yes, please.
Okay, please proceed.
Thank you very much. So in real life, I would greet the patient, introduce myself, and check the identity. I would explain that I'm here to examine his back passage with the help of one gloved lubricated finger. I will take the consent of the patient before I proceed. I'll ask my patient to undress below the waist, for which I'll provide adequate privacy, and I'll ask for a chaperone. I will then ask my patient to lie on his left side with the thighs and the knees bent as close as possible to the chest and the buttocks at the edge of the couch. When my patient, I'm going to start my examination. May I ask for lubricating gel, please?
That is lubricating, okay.
Thank you very much. So on inspection of my patient, I can appreciate that there is not any discharge, no any redness, no swellings, no scars, no any sinuses. I can appreciate there is an unofficial on the posterior aspect of the anus. There is not any external hemorrhoids. I would ask the patients to strain to check for any rectal prolapse. I warn my patient I'm going to insert my finger. I'll place the palm of my finger on the anus sphincter. I will press firmly and gently, and I wait for a few seconds for the sphincter to relax. Slowly, I'll try to introduce my finger. At this stage, I'll check for the comfort of my patient. If he finds the procedure very painful, I will stop the procedure. Inside, there is no vacuum action. I will once again ask the patient to strain to check for rectal prolapse. The right lateral wall is free. I cannot palpate any abnormalities. The posterior wall is also free. I cannot palpate any abnormalities. Okay. The left lateral wall, I can feel there is a mass, which is about 1 centimeter in diameter. It's attached to the left lateral wall. It's not mobile. I would ask my patient for any tenderness. Through the anterior wall, I can palpate the prostate. I can appreciate the two lobes. The right lobe is slightly enlarged in size. The surface is irregular and it is hard in consistency. The right lobe is normal in size. The surface is smooth and is firm in consistency. The median circus is normal. the anterior mucosa is also mobile. I would ask my patient for any tenderness. I warn my patient, I'll be removing my finger. Before that, I'll ask him to squeeze my finger to check for the anatomy. There is not any bleeding or discharge. I would thank my patient for the cooperation and ask him to dress up.